Are you going to get behind though?
Go ahead. Get started.
Okay. Wait, hold on.
Hi.
Sorry for cussing. Okay. So, the United States is the leading country in the diagnosis of ADHD. Every year, the number of cases rises. The Center of Disease Control, the CDC, states that 11% of children from the age of 4 to 17, which totals to 6.4 million, have been diagnosed with ADHD as of 2011. As the number of diagnoses increases, so does the number of misdiagnoses. Nearly 1 million children are misdiagnosed with ADHD every year. Children are being misdiagnosed due to the mechanisms used to diagnose and ADHD mimicking that of other diseases like poor nutrition, food allergy, digestive disorders, low blood sugar, sleep disorders, hearing problems, and environment. Children diagnosed with ADHD are being misdiagnosed and medicated for symptoms that could be relieved with non-pharmacological measures like therapy and diet restrictions. So what is ADHD? ADHD is attention deficit hyperactivity disorder. And it is a problem of not being able to focus, being overactive, not being able to control behavior, or a combination of these. A child must be out of the normal range for the child's age and development also. So the causes of ADHD is unknown, but they do believe it is a combination of genes and the environmental factors are likely to play a role. Symptoms include constant motion, squirming, fidgeting, making careless mistakes, losing things, not listening, and getting easily distracted. The most common medication treatment for ADHD is Ritalin and Adderall. Ritalin and Adderall are stimulants, and they work by controlling brain impulses to regulate behavior and attention. They do this by influencing the neurotransmitters in the brain. Side effects of these stimulants are decreased appetite, difficulty sleeping, stomach ache, headache, increased blood pressure, and stunted growth. The long-term effects of stimulants like Ritalin aren't fully investigated, and there is a link to heart attacks and strokes. The CDC says the prevalence of children between the ages of 4 and 17 taking ADHD medications has increased from 4.8% in 2007 to 6.1% in 2011. On average, an individual with ADHD costs $15,000 a year to treat. $320 million to $500 million a year is spent on unnecessary medication costs. This could be due to children being misdiagnosed and being put on medication. And 80 to 90 million of these costs are being paid by Medicaid. In diagnosing ADHD, there isn't a specific test. How ADHD is diagnosed is from symptoms being reported from schools, caregivers, parents. They also there is a standardized rating scale, which typically just compares the child's behavior to that of other children of the same age group. According to Todd Elder, who is an assistant professor of economics at Michigan State University, there are no neurological markers for ADHD, such as a blood test or an x-ray or anything like that. And experts disagree on its prevalence, fueling intense public debate about whether ADHD is underdiagnosed or overdiagnosed. Basically, they're not really sure if it's being overdiagnosed because there's no test or underdiagnosed. But I do believe it's overdiagnosed. ADHD, like symptoms, can be linked to many different disease processes, such as sleep disorders, hearing problems, low blood sugar, environment, and allergies. So in conclusion, attention deficit hyperactivity disorder is the most common diagnosed disorder among children. 6.4 million children in 2011 were diagnosed with ADHD according to the Center of Disease Control. Every year, on average, ADHD costs $15,000 per person, and on average, there is 1 million children being misdiagnosed with ADHD right now in the United States. The symptoms of ADHD manipulate that of many other conditions. It is important that healthcare providers examine other possibilities that could link a child to symptoms of irritability, lack of concentration, and hyperactivity before a child is given a stimulant like Ritalin, which would have long-term detrimental effects for a child who isn't ADHD, but may be suffering from a food allergen or sleep disorder. That was the worst of the two.
What's the next one?
Same thing, all the information is repeated.
Wait,
That was good. I never
you-
knew that.
you have 280?
Yeah,